Ever wondered how much you can truly trust the health assessment tools used every day,
Hmm.
especially for something as vital as nutrition? You know, imagine if a tool meant to spot malnutrition gave, well, different results depending on who used it.
Yeah, that could be a real problem. Misdiagnosis or maybe no diagnosis at all.
Exactly. So today we're really zeroing in on the critical importance of reliability in these nutritional screening and assessment tools.
That's right. And our mission here for this deep dive is to really get under the hood, understand the methodology behind making sure these tools are, consistently accurate.
Right.
We'll look at how to develop them, sure,
Mm.
but also maybe why some crucial steps get overlooked and what that means in the real world.
Okay, so let's dive in. We're looking at sources that show how to design and analyze studies to evaluate these tools properly. We want to pull out the key insights you need to get up to speed quickly.
Let's do it.
Okay, so let's unpack this a bit. When we talk about a nutritional tool, what exactly are we talking about with reliability? What's the core idea?
Well, for these kinds of tools, reliability usually means inter-rater reliability.
Inter-rater. Okay.
Yeah, think of it like this. It's the agreement between different users, the raters, when they apply the very same tool to the same person.
Oh, okay.
For a tool to be genuinely valuable and for its results to be, reproducible, you absolutely need high agreement.
So, like, if two different nurses assess the same patient.
Their findings should line up closely. Exactly.
Mm.
Otherwise, what good is the tool?
And here's something that really jumped out from the sources. A review looked at 44 nutritional tools, right?
Mhm.
And found less than half, only 20 of them actually reported the tool's reliability.
Wow, only 20 out of 44. That's a pretty big gap.
It really is. It's like, I don't know, buying a car and finding out they never really checked if the brakes work the same way every time.
That's a good analogy.
Even for what seem like simple yes-no questions, you can get inconsistencies. So assessing reliability before a tool gets published and used widely seems, well, crucial.
Absolutely essential. And what's fascinating is how we measure this agreement. It goes beyond just a simple percentage.
Okay.
You use something called the kappa statistic. Think of it as a chance-corrected index of agreement.
Chance corrected, meaning.
So let's say two raters look at 40 subjects and agree 87.5% of the time. That sounds pretty good, right?
Yeah, sounds high.
But the kappa value might actually be, say, 0.737 because it mathematically removes the agreement you'd expect just by pure chance, just randomly guessing.
Ah, I see. So it's tougher measure. What does 0.737 mean then? Good? Bad?
Well, according to standard interpretations, like Shroud's classification, 0.737 is generally considered moderate reliability.
Moderate. That sounds okay, but also maybe not perfect. It implies there's still a fair bit of disagreement that isn't just chance.
Exactly right. Moderate tells you there's still enough variability that it could potentially affect a patient's diagnosis, or maybe the results of a research study using that tool.
Right. It's a signal to be careful.
Definitely. So, knowing what reliability is and how we measure it with things like kappa, how do we actually design a study to make sure we get results we can truly trust?
That's the key question, isn't it? You can't just make a tool in a lab and assume it works perfectly out in a busy clinic, for instance.
Absolutely not. That's a critical point. Reliability is relative. A tool has to be evaluated in its planned setting.
The real world place it'll be used.
Yes, and by the intended professional group. If it's a tool for nurses,
Then nurses need to test it.
precisely. Nurses should be the raters in the reliability study, not just relying on what some research team found, maybe in a different environment.
Okay. And what else?
Then there's sample size. You need to figure out how many subjects to include.
Why is that so important?
Well, if your sample is too small, your conclusions might be shaky, maybe even unethical if you draw strong conclusions from weak data. Too large, and you're just wasting time and resources.
Makes sense.
The goal is usually to get a nice, narrow confidence interval around your reliability estimate. And here's an example. Tools for community patients, where maybe malnutrition is less common.
Okay.
They often need way more subjects. Could be hundreds more than a tool for hospital inpatients, where malnutrition might be, say, 40% prevalent instead of 10%.
Wow, so the prevalence really impacts the sample size needed.
Hugely. It's all about capturing enough actual cases to make your findings solid. And practically speaking, using two raters is often the sweet spot for these studies. More raters add complexity without always adding that much more value.
Gotcha. But what if the tools aren't just simple yes-no? Sometimes nutrition assessments are more nuanced, right?
You're right, they can be. You might get dichotomous data, two categories, like at risk, not at risk.
Okay.
Or ordinal data, where you have ordered categories like mild, moderate, severe risk, or even quantitative data, like a numerical score.
So how does reliability work then?
Well, the analysis methods differ slightly, but for that ordinal data, the ordered categories, the unweighted kappa, is often the way to go.
Unweighted. Why not weighted? Wouldn't you want to penalize bigger disagreements more?
You might think so, and weighted kappa tries to do that.
Yeah.
But the problem is, deciding how much to penalize different levels of disagreement is really subjective.
Ah.
And it makes it hard to compare results across different studies if they all use different weighting schemes. So the simpler unweighted kappa often gives a clearer, more comparable picture.
And for numerical scores.
Even if you analyze the scores themselves using other stats, when you get down to the final risk classification, like deciding if someone is at risk or not at risk based on their score, you should still use the categorical reliability analysis, like kappa.
Right, back to the categories. Okay, so wrapping this up, what's the big takeaway for you, the listener?
Well, I think
It seems like really assessing a tool's reliability isn't just some academic box-ticking exercise.
not at all.
It means you've got to test it in the actual setting it's meant for, with the real people who will use it every day.
Essential.
And using solid statistical methods like that unweighted kappa so you can interpret the results properly and transparently. That's about trust, really.
It absolutely is. It ensures the foundation of any nutritional advice or assessment is something you can genuinely rely on. And maybe running a pilot study first is a good idea for new tools, just to get an initial feel.
Good point.
And maybe a final thought to leave you with. Understanding this whole rigorous process, just for establishing the reliability of a nutritional tool. Well, kind of makes you think, doesn't it?
How so?
How might the reliability or lack thereof of any information source you encounter, news, reviews, anything,
Yep.
how might that impact your trust in your decisions every single day? Something to chew on.